Good morning students, I am Pratima Bhardwaj. So today we will discuss about the Hodgkin's disease. So Hodgkin's disease also is a type of cancer. Okay. Then Hodgkin's disease or Hodgkin's lymphoma T. Hodgkin 1832 clinically is an orderly spread of disease from one lymph node group to another and by the development of systemic symptoms in advanced cases. Okay, so what is Hodgkin disease? Hodgkin disease is also known as Hodgkin's lymphoma, and this is discovered by this is found by T. Hodgkin's. That's why the name of this cancer is Hodgkin's disease. When on 1832. Clinically is an orderly spread of disease, okay, from one lymph. So what happened in Hodgkin disease? The disease or the cancerous condition is spread from one lymph node group to another lymph node group, okay, and by the development of systemic symptoms in advanced cases, okay. Then next is pathologically presence of red Sternberg RS cells is characteristics, okay. So in pathologically condition, what we will see or what will happen in Hodgkin disease, there will be presence of red Sternberg cells, okay. Then this was one of the first cancers to be cured by radiotherapy and later by combination chemotherapy, with a survival rate around 90% when detected early. Okay, if any person will have Hodgkin disease, okay, so it will be cured by radiotherapy. So this is the one of the first cancer which can cured by radiotherapy, and after radiotherapy by the combination of chemotherapy we can treat the Hodgkin disease, okay, with a survival rate around 90% when detected early. If the patient will detected early, so we will cure the cancer condition and we will keep the patient safe, okay. Patient will be alive after the chemotherapy and the radiotherapy treatment. So there is 90% cases can be cured of Hodgkin's disease, okay. Then symptoms. What are the symptoms of Hodgkin disease? Painless enlargement of one or more lymph node, okay. Then splenomegaly means enlargement of the spleen. Then hepatomegaly, it means enlargement of the hepatic, means liver. Then hepatosplenomegaly, it means here both enlargement will be occur, means spleen enlargement also and a liver enlargement also, okay. So in that condition we will say hepatosplenomegaly. Then back pain, then cyclical high grade fever. Then next is systemic symptoms. First is about 1/3 of cases, okay, include low grade fever. Then night sweats, unexplained weight loss. Next is itchy skin and fatigue. So these are the symptoms of Hodgkin's disease, and there is a systemic symptoms also, okay. Then diagnosis. Classical Hodgkin's lymphoma can be classified into 4 pathological subtypes based upon Reed Sternberg cell morphology, okay. So what I have told, there was found Sternberg cells, Reed Sternberg cells in the pathological condition or morphological conditions, okay. So in the Hodgkin's lymphoma there can be 4 classification pathological subtypes based upon the Reed Sternberg cell morphology, okay. Then after the diagnosis, patient will undergo a series of tests and the procedures to determine affected area of the body or staging, okay. When the patient will diagnose that the patient having Hodgkin's disease, after the diagnosis the patient will undergo a series of tests. Which test and a procedure? So which test and procedure? Where we will determine the affected area of the patient. Okay, we will determine the affected area of the body in the patient or staging. Okay, then this procedure include documentation of histology, a physical examination, blood test, x-ray radiograph. So what we will do for the test? Physical examination, blood test, x-ray radiography, CT scan of the chest, abdomen and the pelvis and the bone marrow biopsy we have to do. Then positron emission tomography scan is now usually performed for staging. Okay, so to determine about the staging of cancer, we have to do positron emission tomography. Then the patient is classified according to a staging classification commonly by NN Erber scheme. So what I have told about the staging. So these are the stage. Stage first involves single lymph node region. So if the cancer will involve a single lymph node, so we will denote that condition from L. Okay, or single extra lymphatic site. So if the cancer will be involved lymphatic node also and extra lymphatic site also, so we will denote that condition by the LE. Then next is stage 2 involves two or more lymph node region and a contiguous extra lymphatic site. Okay, so if the cancer condition will involve two or more lymph node region and as well as contiguous extra lymphatic site, so we will denote that by LLE. Okay, double LE. Then stage third involves lymph node regions on both sides of diaphragm, which may include the spleen, LLLS, and a limited contiguous extra lymphatic organ or site. Okay, so if the cancer condition will involve lymph node region on both side of the diaphragm, okay, and which may include the spleen also, so in that condition we will denote by LLLS, okay, triple LS, and a limited contiguous extra lymphatic organ or site. Then stage fourth involves one or more extra lymphatic organs. So stage 4 is the last stage of the Hodgkin's disease. So in this stage the cancer will be involve one or more extra lymphatic organs. Okay. The absence of systemic symptoms is signified by adding A to the stage and by adding B for the presence of the same. Okay, I have told about the systemic symptoms. So if the patient having systemic symptom in the Hodgkin's disease, so we will denote that by capital A. Okay, to the stage means if the patient is in second stage, okay, or and there is present systemic symptom also. Okay, so we will denote that condition by capital A. Okay, stage 2A. Okay, then and by adding B for the presence of the same. Okay, फिर क्या हो रहा है, ए किस लिए डिनोट कर रहे हैं, एब्सेंस, यानी कि सिस्टेमिक सिम्टम्स अगर नहीं है तो, ठीक है. देन बी कब डिनोट कर रहे हैं, जब सिस्टेमिक सिम्टम प्रेजेंट है तो. ओके, देन फॉर लोकलाइज्ड एक्स्ट्रा नोडल एक्सटेंशन फ्रॉम मास ऑफ नोड्स विच डज नॉट एडवांस द स्टेज सबस्क्रिप्ट ई इज एडेड. अब क्या हो रहा है, लोकलाइज्ड एक्स्ट्रा नोडल एक्सटेंशन फ्रॉम मास ऑफ नोड्स. नोड्स में क्या हो रहे हैं, लिम्फ नोड्स में एक्स्ट्रा नोडल मास है, ठीक है, एक्सटेंशन हो गया है. ओके, नोड से, तब विच डज नॉट एडवांस द स्टेज सबस्क्रिप्ट ई इज एडेड. अगर वो एडवांस स्टेज में नहीं है, मतलब स्टेज 4 में नहीं है, लास्ट स्टेज में नहीं है, तो उसको किससे डिनोट करेंगे, ई से. देन प्रोग्नोसिस. The adverse prognostic factor identified include age more or equal than 45 years, stage 4th disease. So if the patient age is more than 45 or equal to 45 and the patient will be in the stage 4th, Okay, so hemoglobin will less than 10.5 gram per deciliter, and the lymphocyte count will be less than 600 mu liter or more than 8%. Okay, then in the male, albumin will be less than 4.0 gram per deciliter, and the WBC count more than or equal to 15,000 mu liter. Okay, then treatment. Early stage patients, first A or second A, effectively treated with radiography or chemotherapy. Okay, so what I have told, in the absence of systemic symptom, we will denote by stage first A. Okay, so here also early stage patient, early who are the early stage patient? For stage first A or stage second A. Okay, effectively treated with radiography or chemotherapy. So the stage first A or the stage second A patient will be easily treated by the radiography or chemotherapy effectively. Okay, then choice on basis of age, sex, bulk and the histology subtypes. Okay, the treatment will be provided according to the choice of basis of age, according to the age of patient, sex, bulk and the histological subtypes. Then next is later stage, stage third, fourth A or fourth B are treated with combination chemotherapy alone. Okay, adriamycin, bleomycin, vinblastine and dacarbazine or ABVD for 6 to 8 months or longer if required. Okay, so these are the chemotherapeutic drug which will be give with the combination. Okay, so what are the drugs? Adriamycin, bleomycin, vinblastine and dacarbazine, or we can also call that ABVD. Okay, so we will provide that chemotherapeutic drug for 6 to 8 months or longer also if required. Okay, then any stage with a large mass in the chest is usually treated with combined chemotherapy and radiation therapy. So in any stage, stage first to fourth. Okay, in the any stage, if the patient having large mass, okay, in the chest, so is usually treated with combined chemotherapy, okay, and radiation therapy. So we have done Hodgkin lymphoma or Hodgkin disease. Hope you will like it and you will understand this. Thank you.